Welcome to the iSpace Wellbeing Expert Talk Series, bringing you advice, tips, and great conversation about mental health and well-being in young people. iSpace Wellbeing is a free of charge, multi-award winning mental health and well-being solution for schools. Using a whole school, progressive and evidence-based approach, we make conversations about mental health and well-being flow naturally, both inside and outside of the classroom. Our fun, age-appropriate framework starts from 4 years old and covers all the key stages of a child's education. Schools choosing iSpace Wellbeing will not only give their teachers access to over 200 digital lessons, plans, and other resources, but also free CPD-accredited training. Why not join the growing number of schools around the globe who are choosing iSpace Wellbeing for their students' mental health and well-being education? For more information, visit iSpaceWellbeing.com.
Introduce ourselves because this is our first real live series, and it is, our series that we're going to be doing throughout the month of May on mental health matters for young people. And I'm delighted this evening to be welcoming you, Nancy, with us, and I'll give you a proper introduction in a moment. But these live series are being run by iSpace Wellbeing, which is the well-being, mental health and well-being solutions for schools. We have set up a mental health and well-being curriculum with lots and lots of resources for schools to be able to use to support and help their young people in learning lots of language and tools around how to look after their mental health. And it is absolutely free to schools. So any school can sign up for this. Teachers get free training to be able to deliver this resource into their schools. And it is not just for the pandemic, it is unlimited free access to this resource. So anyone out there who is listening, who's a parent or a teacher, please recommend this to your schools. Go and have a look at the website and have access to this wonderful resource that is available to you. And so I am Paula
I was going to
Talman.
say, I can testify to that. Having seen it, it is absolutely amazing. It's so creative, and it's a lovely way to just normalize conversations using kind of characters, and it's just an accessible way, and it's very much needed. Like, yeah, definitely
Oh,
get it.
thank you, Nancy. Thank you. Um, and so I am Paula Talman. I am the founder of iSpace Wellbeing. And I created this resource for school, this language and tools to be able to support and help children across the world. I have 25 years of experience in child and family healthcare, worked across the hospital sectors and within education as well. And I did research on self-harm because I did an awful lot of work with young people and families who experienced self-harm. And I'm absolutely thrilled to have you, Dr. Nancy Nsiah, with us this evening, who is a clinical psychologist with a passion for supporting minority ethnic communities to access culturally sensitive psychological therapies. You are also a co-author of a chapter in a book highlighting the importance of incorporating race and faith as part of therapeutic practice, which is amazing. And you run a mentoring service alongside your private practice and your NHS role within Great Ormond Street Hospital, supporting the children and professionals there in services across the lifespan, which is wonderful. And I am thrilled to be able to say that you are also an advisor on the iSpace Wellbeing Advisory Board, which is great to have you with us, Nancy, helping us with everything that we do. And what is really, really special also is that you are part of an advisory committee for clinical psychology doctorate program, and that you've also set up independently a mentoring initiative which addresses the underrepresentation of BAME professionals across the clinical psychology profession. And I think that's really important, the work that you are doing there as well.
Thank
So
you.
welcome with us
Thank
this
you.
evening. So to start off, I just want to say that this conversation this evening on self-harm, it's a really important topic,
Mm,
and it was a really important topic before the pandemic. And before the pandemic, it was the statistics were saying that 1 in 12 young people deliberately self-harmed. And I think that that figure probably is actually higher than that, because with the pandemic, we know that lots of people have been under an awful lot of stress and strain. And also, this particular behavior can often be quite secretive, so we don't always know the exact numbers.
yeah.
And I think that it's really important that although our talk this evening is for parents and teachers, that we're also very aware that there may be young people watching this evening. And I want to really recognize for them that we understand that the pandemic has been, extremely hard for all of you, and that we want to be aware that we are trying to support in whatever way we can, and that in highlighting this topic this evening, that we might be able to help to give people the knowledge and understanding that they need to encourage and to reassure those young people that you can come forward and ask
Mm,
for help without judgment. What do you think,
yeah.
Nancy?
I was going to add to that. I mean, definitely, I think the pandemic has given rise to a lot of kind of additional challenges. It's just added another layer. And not just because, the uncertainty around the pandemic, but also, the changes around, for example, schooling and what's going to happen with exams, or, the impact, the long lasting impact is more than just those lockdown periods. So it's understandably been intense, and that self-harm also does affect people across the lifespan, so older people, adults,
Yeah,
as well as young people. But I guess today what we're focusing on is young people. Um, and just for people to make sure they look after themselves. We're talking about something that might feel triggering for some people, or really kind of connect to some of the experiences that they have. So, connect to any of the services maybe that we highlight at the end, in case anything does come up for you. But definitely just, yeah, be mindful of, yeah,
yeah.
how you're feeling.
Absolutely. And I suppose for everybody listening, in order to really help them to gain an understanding of self-harm, is to
Mm,
start off with what it actually is. So,
yeah.
how would you describe it to the people listening if we're thinking about our parents and teachers and young people? How would we describe it to them so that they have an understanding?
I think I would describe it as anything, I guess, when you hurt yourself as a way of dealing with very difficult feelings or painful memories, sometimes with in response to kind of overwhelming situations. And maybe the reasons why or how people self-harm might differ from person to person. But when we think of self-harm, it might include scratching or picking at your skin, cutting yourself, including burning, you know, hitting yourself, punching yourself, pulling out your hair. So there's a full range. I think often what gets presented in the media is the idea of just cutting, but it
Yes,
is a full range of kind of self-injurious behaviors, anything that kind of, I guess, causes harm to you.
absolutely.
Um, yeah,
And sometimes it can often get missed in boys, because boys sometimes, when they're managing their behavior, they do it quite aggressively, and they hit things and punch things. And in some ways, that is a form of self-harm as well. And so sometimes that again isn't often picked up. So it's really important that we are aware of those types of behavior as well. Um,
absolutely. Yeah, when thinking about kind of how might you notice it, the things we're talking about are pretty much things that you might see evidence of. It's physically on the body, etc. But if you think of it like an iceberg, often what we can just see is that tip, but everything else that's going on underneath it, that's kind of the real root of what's going on, we often miss. So you're more likely to see kind of behaviors as more of an exhibiting kind of that there's more going on, essentially. So yeah, when you was
yes.
kind of describing with boys, maybe you won't see someone kind of cutting or scars on their arm, but you might see kind of more behaviors that suggest actually maybe they're really struggling.
Absolutely. I love that analogy of the iceberg because self-harm in itself is a behavior, and it quite often represents that deep emotion that is underneath, caused by numerous different
Mm,
things. So
mm.
what kind of things might be cropping up for our young people, Nancy, that might be an indicator?
It could be in terms of what might be happening in their life that could
Yeah,
self-harm. Could be going through kind of different stressful events. So exam periods, a lot of
yeah,
people, young people I see during exam periods find that especially difficult to cope with. It might be an indication of more kind of difficult family dynamics. Sometimes it's a result of some people being physically, emotionally, sexually abused. It's essentially a way of almost expressing something that's hard to kind of put in words, almost turning the invisible thoughts and feelings into something visible, but there's an emotional pain underlying that. So, and also that for some people, that might kind of be like a very discrete short period of self-harming, whereas for other people it might be connected to particular triggers. So for example, high stress periods, that's when you might notice that they engage in self-harming behaviors. Or for some people they end up kind of using it as a long over a long period of time, but the triggers that might motivate one person might be completely different from another person, because we all have different things that we become kind of more sensitive to, or that we feel that we are better able to or less able to manage, depending on the resources that we have, depending on how much
absolutely.
we've heard and validated. So yeah, it's a lot that could feed
Yeah.
into harming behavior.
Absolutely. And I think with the pandemic, some of the conversations I've been having with young people has been around, that um, fear of falling behind in their work,
Mm,
difficulties in trying to wonder where they are, how much do they have to catch up, and in some ways even going back to just be back in that social sphere again and trying to regain friendships that they feel that they lost touch with, and finding that a challenge to fit back in again, and just the stress of changing routine as well, trying to change from that routine that they got themselves into at home into transfer. It's almost like going through transition again,
mm.
and the stresses that can be bringing back for them. Um, so
I was also thinking about kind of sometimes when people kind of feel quite numb, this idea that sometimes causing yourself pain might help you kind of feel alive, or some people doing it as a response to feeling shame or guilt and wanting to punish themselves as a result of it. So there's so many different emotions that might trigger it or feed into self-harm. So yeah, just kind of being mindful of what that person's triggers might be. And sometimes we
yeah,
don't even you don't even know until you're
no.
really kind of exploring and unpicking that. You just notice that you feel this overwhelming sense of needing to release, I guess.
Absolutely. And I think it's really important that when you mentioned it a little earlier, you touched on it, is that, this behavior is a coping behavior. And sometimes it's discovered as a coping behavior because they didn't actually have the resources, alternative resources to help them to cope with that pain that they were feeling. Um, and the way you described it as a release as well, that sometimes they feel that it's this like when I've talked to young people, they talk about how it's releasing a pressure,
Mm-hmm.
um, and they have discovered it as a coping mechanism. Whereas when I thought about designing the resources for schools, I was thinking very much about the young people I had worked with, and to really be able to give them so many other alternatives and
Mm-hmm.
resources and tools, and a language that they could use. Because when I worked in the field of mental health with young people who needed extra support for what they were trying to manage, quite often what they explained to me was that they were really finding it hard to know who and how to ask for help. Is that something that you experience in your field of work as well, Nancy?
Yeah, absolutely. You just kind of become more aware of how much stigma is kind of connected to experiences around self-harming. Almost as well with social media, I think a lot of kind of images around assuming that people kind of have it all together all the time, and how that can make you just feel so much more disconnected to wait, am I the only one who struggles in this way, and make it difficult to kind of to speak out. But yeah, absolutely about finding it difficult. And sometimes as adults, maybe sometimes forgetting what it was like younger, kind of trivializing those difficulties as, oh, that's nothing, you know, compared to whatever it might be. But actually for that person, that's everything for them. And it's so
Absolutely.
important to validate those experiences for that
Yes.
individual, because those serve as further barriers to people even being able to talk about these challenges.
Absolutely. And I think that will bring us on to the next little point that we can talk about, which is how to talk to young people. And I'd like to just really kind of signpost people to two little videos that I absolutely love that really help you understand how to talk to young people and to really empathize with them. So Brené Brown has a fantastic little video on empathy, and it talks about, get down into the hole. Go into the hole with them, sit, experience it. Sometimes you don't have to say anything at all. And the second one is from Inside Out, which is an amazing animation. And there's a lovely little piece in it where the character Sadness sits with a elephant who is trying to really explain how he's feeling. Joy, the character who's always happy, is not really listening to how the elephant is feeling and trying to distract and say, come on, let's go over here and do this instead. And Sadness just sits and go, oh, she says, that sounds really tough. That sound, I can, really sounds really hard what you're going through. Tell me more about it. And so those are two little videos are really, really good to have a look at about empathy and sitting and listening. Sometimes we feel we have to fix things and we have to do the talking, but actually, in this kind of situation, the listening is probably the most important. What advice would you give to people about perhaps if you've discovered it or someone tells you about someone who's self-harming? What's the reaction that people should be responding with?
I think most of us, when we hear that somebody is in pain or at risk of harm or danger, it brings up anxiety in us. We want to get rid of that pain. We don't want them to suffer with that. So it's an understandable emotion that kind of comes up that drives us potentially to want to reduce the harm, to be able to kind of stop it, to make it feel, better. But actually kind of just pausing that and really just kind of tuning into what does this person need now. And often actually in the first instance, maybe someone might not want to talk about it. And that's why it's important to keep the door open, just to keep
Yes.
checking in with them, and to honor your word about how you check in with them, even if it's like, it's okay if I just catch up with you next week. So for example, I'm thinking in the context of schools where things are so busy and there's so many pupils, remembering that, just to hold that in mind so that you
Yes.
can go back to that person. What that does is that shows you that you are holding them in mind. They are important. You do care about them. That actually
Yes.
speaks volumes. And in terms of kind of just talking to them, if you're noticing it, in the same way where if we noticed any other kind of injury on somebody, etc., just naming it. I did notice that you have some cuts on your arm. Can I ask how are
Yes.
you doing? What's going on? Like, having that conversation. I think if we start to think of it as self-harm, a lot of people can go, oh, I don't know if I'm skilled enough to have that conversation. Actually, your empathy means you're skilled enough. Your
Yes.
humanness means you're skilled enough. Your listening skills means you're skilled enough. So just kind of not worrying about kind of getting it right, just listening, really tuning into what
Absolutely.
their experience is. They may not have the answers, and that's absolutely fine. It might just be what you're hearing is that it's difficult. Just
Yes.
validate that emotion, that it is difficult. But also in talking to them, I think it's also important to ensure you're not promising around not being able to tell anybody or what have you, being very clear around what happens with that conversation, so that trust and expectation is held around, okay, where's this going? Are you going to tell this person? Just, highlighting that can be a lot really important for that transparency in that relationship. Yeah. And it also makes me think that kind of if someone has opened up about it, thinking around maybe sometimes around non-verbal communication type ways of
Yes.
exploring that. So for example, I love the like zones of regulation. So traffic lights, red, yellow, green, right? And you're thinking about how might you develop a plan with them where they just kind of, a way that they can kind of nudge you and be like, yeah, it's a difficult day today. I feel
Yes.
an urge to self-harm, right? So that's the red zone. And you kind of agree when they're not in that kind of difficult, overwhelming emotional state, kind of agreeing beforehand. So if you're red, what would you like me to do? How would you like me to approach you, etc.? And that might just be like, just sit next to me, or
Yes.
just give me space, or whatever it might be, right? And then you've got the yellow, or it might be stay with me until I'm in the yellow. And how would you know you're in the yellow? What are the behaviors that I might see? Oh, I might start talking to you a bit more, I might actually, agree to go for a walk with you, what have you. And then the green is when they're feeling a little bit more comfortable. So just remembering that not everybody wants to talk, like, ironic
Absolutely.
from psychologists, not everybody wants to talk, and that's absolutely fine. Think about how does that young person communicate? What do they find as the most meaningful and powerful way to connect with people? Just sitting by them, like,
Yes.
your physical presence is comforting. And so, sadly, with the business of this world, that's one thing that we kind of
Yeah.
lose. But yeah.
Absolutely. Yes, I think for people listening out there, it's about, silences are okay, and in fact,
Yeah.
silences sometimes are what's needed. And I think from my experience with working with teachers and with parents as well, is that knowing that talking about these things does not increase them. Uh,
Yes.
it's really
Myth
important to know
busting. There you go.
talking about these things does not increase it. And for the young people who are listening out there, talking and asking for help is your first huge step towards looking at alternatives. And I love the fact that you mentioned, that this is their coping mechanism right here, right now. So to jump in and go, we're taking that away is
Mm,
taking away a security. But if we move slowly and we work with that young people and we
yeah.
go with that young person and we explore the alternatives together, then that is a big step towards moving from what they're doing now into what we probably would call a more helpful coping strategy than the one that they're on at the moment. And making sure that that initial, although discovering something like this has a natural instinct to make us feel anxious or worried, that just knowing that not showing judgment on the behavior, but rather looking beneath the iceberg at the bottom and focusing on that rather than identifying the individual by the self-harm, because
Yeah.
young people don't want to be identified by the self-harm behavior. They want us to look beneath and to help them to manage and cope with
Mm,
the experiences that they're having,
mm.
and to have an understanding of what they're going through. So I'm
Can I
just
just
wondering,
quickly add
sorry,
as
go
well,
ahead.
Paula? I
Yeah,
was thinking about when a young person does open up. Um, First, that's a moment to celebrate, because
yeah,
that can be so tough. So
yes,
celebrate that. Celebrate that you are moving towards a position of saying, I want to change.
yes,
Celebrate the fact that you've had the courage to do that. Celebrate that you've been able to identify someone that's hopefully going to be able to kind of really listen to you. It's not a small task, and it may feel like nothing in comparison to everything else, but it absolutely is a moment to celebrate.
absolutely. Absolutely. And just reinforcing that security for that young person, and making it that positive experience that what they have done is the right thing in coming forward, because it takes courage and bravery to take that first step. And we want to reassure young people that we're here and we're ready to listen, we're ready to support and to help. And I think that really is a really good point actually to come on to myths around self-harm, because some people would say that this is attention-seeking behavior. Now, I have my own views on this, Nancy, but I want to hear what your views are, and what your responses to somebody who might use that terminology around self-harm.
It's That one really baffles me, that we might consider it attention seeking when a lot of people hide their scars, and a
Yes.
lot of people do things to intentionally cover it up. So um, perhaps as a slight reframe, attention seeking in the sense of wanting to be able to have help, but not necessarily in a way of manipulating people to say, oh, I just want everyone to focus on me. Now that's very different.
Yeah,
So it's not intended as a manipulative act. It might just be, I guess there's some studies that have talked about for some young people just saying it's just a sign of just how desperate I am and feeling like I need that help.
yeah,
Um, and almost like how do I even ask for that? How do I say that? You know, some people are grateful that someone has even noticed that this is what they're going through, and other people
absolutely.
can really shy away from it and completely try and deny it, etc. But attention seeking definitely doesn't come to my mind when I think about
No,
that. So I would say myth busting, that's definitely a myth.
absolutely. I like to try to give other words in response to that for people so that they have a different way of thinking. And one type of way of talking about it might be it's attention needing. They need that attention. They need help, or even attachment needing. They need to feel attached and connected to someone so that they can get support for those really deep, intense feelings that they might be experiencing. So definitely that is something that we need to tackle so that we reduce stigma around this behavior. And I also thought about, social media, and that, sometimes social media can be a great source of support for young people. And certainly through the pandemic, that is exactly what it has been. But it's almost like a little bit like Star Wars. There's the bright side and the dark side
Yeah,
to social media. And,
yeah.
I think that there is some information on social media that misguides young people. And what advice can we give them to try and steer them away from that and use the more helpful
Mhm.
path?
I think, as with anything, you need to check it's coming from a credible source. And so sometimes the best go to might be kind of the big charity names, just because they've got a wider platform. Sometimes they're more likely to be informed by research, which means basically just talking to lots of people and gathering those experiences. Um, and that can feel a little bit more reliable. The thing with social media is that anyone can have social media, and that
Yeah,
means social media is often a lot of people's opinions, and the opinions doesn't mean that it's fact or that it's true. So it's about kind of using that discernment and thinking, actually, okay,
yeah,
what are the reputable sources, what are the places that have got that stamp of, yeah, this is a good source that I could reference. It's a little bit like Wikipedia, right? If you're writing an essay, Wikipedia isn't the one to really cite,
yeah,
but if
yeah,
you've got a journal or book, it's like that. So think about it like that when you're on social media. And just connected to the idea of social media is often we can kind of have quite siloed, you know, you follow X number of people. So everything you see is just produced by X number of people, wanting to kind of broaden that out because,
yes,
our life is more than just kind of one component, and self-harm and the difficulties around that is kind of just one aspect of people's identity. So reconnecting, using social media as a way to kind of connect with other aspects of your identity so it can be nourishing, and being mindful of what you consume. It might not be that
yeah,
someone is giving you false information about self-harm, etc., but you may notice that whenever you're watching this personal show or whatever, that you feel a real sense of FOMO, fear of missing out, and a real
yes,
sense of how do I compare to that? That's one, don't know what's happened when their battery's dead, and what's going on in their life. It's not necessarily an accurate representation. So just taking everything with a pinch of salt.
yeah.
Um,
Absolutely. And then that kind of links me into another myth about how um, it's said that this type of behavior sits in certain groups of people,
mm,
like people who might have a Gothic kind of foundation, or part of a Gothic type of group, or you might hear the other terminology of emos and things like that. What would you say to that?
it doesn't discriminate.
No, it
Yeah, this
doesn't.
this is this is yeah, it doesn't discriminate. It could affect anybody.
Absolutely.
And I think that
Absolutely.
actually probably enhances that stigma of I can't say anything because it's only this assumption is only associated with particular groups,
Yes.
but it doesn't discriminate against ethnicity, around age, etc. There may be some more groups that are more at risk. Um, so, for example, sexuality sometimes can have more enhanced risk, and just I guess more so from that sense of feeling isolated and the additional
Yes.
stigmas that people are kind of going through. But no, it's not kind of linked to music taste. You can like, I don't know what emo music entails, or you
Yeah.
can like R&B. You know,
Yeah.
the reality is that that doesn't preclude you from experiencing self-harm or
Absolutely.
yeah.
Yeah. And then there's another myth about how it is related to suicide. And I'll let you kind of explain this, Nancy, because you'll know more about this and how to explain it. But um, there's a certain a link between self-harm and suicide, but yet it's not the intention. So can you describe that a little bit more for the people listening?
Yeah, so I guess if you think about suicide as, I guess actively wanting to end your life versus what we've talked about with the definition of self-harm, kind of a lot of people using it as a way of coping. If anything, it kind of helps people to extend their life. They really want to be able to kind of um to cope, to be able to kind of manage those difficult, intense feelings. Now, that means that you can, at times, have that sense of suicidality. Whenever I can say the word, in terms of feeling like, just things are so overwhelming and, what's the point of life and what have you. And it's really important for whoever is maybe exploring that with you just to check that out, just to make sure.
Absolutely. Yeah.
Um, and of course if you are experiencing those thoughts, for you to try and reach out just so that somebody else can try and just help you work through that, so you don't have to do that independently, whether that's through a telephone organization like the Samaritan. So it doesn't even necessarily have to be somebody that you know. It is really important to kind of help process that, but yes, the two, one doesn't equal the other, basically. Yeah.
Absolutely. And what young people quite often talk to me about, and certainly in my work that I did within the hospital sector, is that they will talk about self-harm in a way that actually in some ways helps them to feel alive,
Mm,
and that it gives them a sense of that feeling alive, letting that pressure off. It's the release of all those emotions, and it gives them that sense of feeling alive. Whereas, and you're quite right, absolutely, if young people are having any types of suicidal thoughts or um, anything like that, do reach out and talk to someone, either, at home, at school,
mm,
or even just pick up the phone and call any of the free helplines like Shout and Samaritans. And Childline is also there as an amazing support as well. And we will put up support helplines at the end of this conversation as well, so that they're there for you to be able to use. They're 24/7 services, so you can use them at any time. But always reach out, check it out with somebody, talk about it, because again, that talking is that step towards getting the support and help that you need. Um, so brilliant. So what we're going to do now is we're just going to move on to, we talked a little bit about signs and symptoms, and I probably add another one to the signs and symptoms that we've already talked about, Nancy. And what I've quite often seen within my work with young people is the way that they talk about themselves. Um, that sense of low self-esteem, low self-worth, hopelessness, those type of conversations about themselves, putting
yes.
themselves down. Um, if you're listening to a young person and they're speaking about themselves in that way, explore it a little bit more with them, find out where is that coming from, and then see if there's some alternative ways of supporting and helping them. Um, and I suppose what kind of techniques could we offer to as kind of tips to young people or their parents or the teachers for those individuals who have an urge to self-harm, what could we offer them so that when they feel that urge, that perhaps they could use that as an alternative?
Mm. So you remember when we were talking about the different motivations might differ? So whether that's around kind of feeling numb versus feeling
Mm,
isolated, lonely, etc. So if there's, for example, numbness, um, some people kind of have like an elastic band and to kind of flick that. And what that does, I guess, is it gives you, in some ways, it kind of grounds you. You notice that sensation, right? So it's
yeah,
kind of offsetting against the numbness, or holding ice cubes, or
yeah,
smelling something that's got really strong odor. I don't know if dirty socks are going to be enough. It might be something a little bit more. Or having a really cold shower, and that might kind of just,
yeah,
yeah, I guess it offsets against that sense of numbness. Whereas if it was anger, it might be about kind of doing some exercise, some vigorous exercise, or hitting cushions, or shouting, or crying, or tearing up lots of paper, etc. And it's okay if some of those don't work for you. Test those out, test out whichever ones
yeah,
might cause even just a little shift, and then keep trying that one again and again. Because the thing is, with particularly uh, with self-harm behavior, it can become a habit. So if you are cutting or harming yourself, you kind of have that, um, it produces the adrenaline, then the endorphins kick in, and so for a few minutes you feel good, and what
yeah.
that little bit of feeling good for a couple of minutes or so can become addictive. And habits are formed through accumulated repetition. Oh, I'm not sure, I think you've frozen. Oh, okay. I was saying habits are formed by
Oh, am I
accumulated
frozen?
repetition.
You're still
No,
talking.
you're back. You're back now. Yeah. Um, I was saying habits can be formed by accumulated repetition, and for that reason, the more we do it, the bigger that habit, that stronger that habit comes. So it's a little bit like a muscle. Imagine if you always were flexing this one muscle and you had that Popeye arm.
And let's see if we can. There we go. Hopefully, Nancy will be back with us now in a second. We're just waiting for her to join. And there we are, the joy
Yay.
of the internet, Nancy.
The joy.
Anything can happen at any time. I was just explaining back to everybody where we were, and that we've been just discussing about the different kinds of techniques that we can use to help to just distract from the urge of wanting to self-harm. And you've beautifully gone through a number of those. We were talking about the cold shower. We were talking about ice cubes, allowing them to melt away in the hands. Um, and there's another little technique that people can use, which is you were talking about when it's expressed with when anger is perhaps a trigger, and it's punching bags and punching pillows and things like that that you can also use as well. But also maybe using a marker, a red marker, and maybe
Yeah.
and drawing on the skin as well. Some people find that that's really helpful and a very good distraction. And you also, of course, talked about those elastic bands, which are also very helpful and easy to come by in schools as well. Elastic bands to offer our young
Mm.
people. And then I suppose we can think about alternative coping mechanisms. What can help them when we've used those distraction techniques, and then we want to move them then onto an alternative that perhaps might help. And of course, everyone is an individual, and what might help one may not help another. And so it's sometimes through exploration as to what can be really useful. What kind of things might
That was
you suggest?
Sorry, that was the bit where I think I got cut off, so I'm not
Oh,
too sure whether or not
hope we can get. Yeah,
it
I think you're
it
back with
picked
us.
up. I guess I was I get highlighting that essentially self-harming ends up becoming a habit if it's kind of something you do over and over again. And so that adrenaline kind of causes these endorphins to kick in, and so we feel good for a couple of minutes, and that's the bit that becomes addictive. So we use that because we get that relief for a few minutes, and it feels better than the
Yes,
pain that might have driven it. And so if you imagine that you were just flexing one muscle all the time, exercising that muscle, and you have a big Popeye arm, versus
yes,
you're now trying out a strategy and oh, that doesn't feel like that works versus this. If it just caused a little shift, keep going, because habits are formed
Yes.
by accumulated repetition. The same way the habit can be formed through self-harming, the same way a kind of alternative approach can be used to I guess to combat self-harm. In terms
Yeah.
of your question, what were you thinking of?
Well, actually, I'm just thinking, Nancy, I'd like to add to what you've just described for everybody. And there's this cycle to self-harm as well in terms of the habit that you've
Mm-hmm.
nicely, beautifully described. But sometimes after that feeling that it helped you to cope, can come in that sense of shame and embarrassment, and then that can
Mm-hmm.
also drive the cycle around as well.
Mm.
Whereas if we can shift, as you say, and try and really exercise that other muscle into an alternative that works really well for you, the cycle shifts because it's through a sense of feeling good that wants you
Mm.
to go back through the cycle again, and that shame and embarrassment can be removed.
So I guess it makes me think a little bit about cognitive behavioral therapy. It's just a
Mm,
fancy way of thinking about how our thoughts connect with how we are feeling and what we do, and being able to kind of challenge some of those thoughts, those critical thoughts that
yeah,
might come up that keep you in that space, and being able to think about in a more balanced way and think about what's the evidence for this. Is this true, or am I kind of leaning more towards something else? And is that a helpful way of thinking? So essentially what you want to do is to be able to try and maybe challenge those thoughts. And some people find kind of compassionate letter writing really
yes,
helpful.
lovely.
Um, Being able to kind of write a letter to, as though you were talking to your friend. We tend to talk to our friends nicer than we talk to ourselves. So, what would a friend say to you in this moment? Just trying to kind of tackle that underlying, like you were saying, around some of the shame or the guilt that might come up,
Yes,
helping to process that underlying emotion. Or it might just be talking to a friend
yeah,
about it to help you kind of make sense of it. It might not be that you're talking about the actual act, but around the
yes.
frustration or the emotion that's driven that.
Absolutely. Very good. I think that connecting with a friend, with anyone that you feel safe and secure with is always a good step in the right direction. And so let's think of these things that we want to, this little muscle over here that we might like to pump up and build up by repetition. And what some of those kind of alternative little tools might be. Um, so like we all know that exercise is really good for the body and the mind, and not everybody enjoys exercise, and a lot of people find it hard to get started, and certainly for some people who maybe hadn't got very active over lockdown, those muscles are feeling quite weak at the moment, and it feels really hard to get it going again. I think I'm certainly one of those people, and I need to get moving and exercise those muscles. Um, but because we know that exercise has this really
Oh,
good
I think
factor,
it's frozen again.
has it frozen? I can hear you.
Okay.
Hopefully, people can still hear me. I think that we know that exercise, lowers our cortisol, our stress hormone, and
Mm-hmm.
it gives us those endorphins, those feel-good hormones that actually some people might feel through that act of self-harm. So we can replace endorphins through using exercise instead. Getting outside in nature, of course, can also increase endorphins, and serotonin as well, which is a neurotransmitter for boosting our mood. So that getting outside in nature really important too. But what other things could we um, possibly put out there for young people to try as an alternative?
Do you know, it's because it is so unique to individuals. I like to think of it as anything that helps to give you a sense of I did that mastery,
Yeah.
right? Something that you feel good at, something that you do well, or something that gives you a sense of pleasure. So
Yes.
whether that is kind of art, whether it's listening, for me it's listening to our old school R&B music, whatever it might be, really connecting into those things. It doesn't have to be fancy, it doesn't have to be a really special, unique things. It's sometimes some of the most basic things that we're just overlooking because
Yes.
everything feels so overwhelming. there's this idea around there's this triangle called Maslow's hierarchy of needs, and you kind of need the basic stuff, right? You need to
Yeah.
kind of have food, shelter, safety, etc. And so really thinking about, what am I missing? What might I need to be able to kind of get? Is it a sense of connecting with other people? So can I
Yes.
reach out to friends? Can I give them a call? Can I text them? Can I um, yeah, whatever it might be? Or is it that I want to have a sense of like being able to achieve something and mastery, when, especially if you're doing exams and you feel like, oh, this is so overwhelming, I can't get it. Well, what are you good at? What do you want to
Yeah.
spend some time to?
Absolutely.
Those
I
things
agree.
especially
And
nourish you.
hopefully, yeah, I totally agree. I think they're wonderful, wonderful alternatives for young people. And of course, you mentioned music. Music is so great and uplifting. And also art, if you're interested in art, doodling is just a great form of helping you to relax.
Yeah,
And you can also use those lovely mindful art pieces of work that you can color in.
just books. Yeah,
Yeah, really helpful. And like I love pottery. I love getting a lump of
mm,
clay and just really getting involved and just, the touch and your anything that really enhances your senses because it's very
mm-hmm.
grounding, isn't it? So if you can,
Yeah,
what you can see, what you can hear, what you can smell, what you can touch, what you can taste, and certainly a little grounding technique is numbering them. So the five things you can see, the four things you can hear, the
please.
three things you can touch, two things you can smell, one thing you love to taste if you're not near the fridge and can taste it.
Yeah,
So things that you like to smell, things you like to taste, and just imagining those things can really help you feel grounded. So
yeah.
trying anything that gives you, try something new,
Mm,
and you might discover something that you really, really like. So all of those things can be really, really useful. And the journaling that you already mentioned, writing your
mm,
feelings down
mm,
and really getting them out that way. It can be a release, another type of release for you.
yeah.
And so trying those things as well. And then I suppose we really probably need to think about where we can signpost young people, parents, and teachers as well. But before, actually, Nancy, we're going to just finish off on that. I love that you mentioned Maslow's hierarchy of needs, that triangle. And for
Mm-hmm.
parents and teachers out there who may not know what that is, or even for children out there who might be listening who don't know what it is, the foundation of it all is that security,
Yeah.
feeling secure. And so one thing I really love saying to people when I'm talking to parents and teachers and children is tell each other you love each other every day.
Mhm.
Just say, tell it. We feel it. We know we
Yeah.
do, but we forget to say it. So tell that young person you love them every day unconditionally because
Yeah.
that is the foundation of that triangle that you were talking about, that security, that feeling that you're loved, and that no matter what happens, that you're always there for them and you love them. Um,
Mm.
so that's just a really little one of my little tips that I'd like to give. But signposting, Nancy, where can we signpost people?
There's this for schools, mentally healthy
Yeah,
schools.org.uk. So that's like the Anna Freud Center have kind of compiled like these great resources for all aspects around mental health. And they have some really good plans on there. And really practical resources that you can implement. Often, as well, thinking about kind of self harm in the context of schools, I think it's also important to acknowledge that as teachers, looking after yourself as well,
yes,
it is not the most um it can be the most, it can be challenging to kind of hear somebody in distress and really feel like, oh my goodness, what do I do? So really looking after yourself, especially when you have so much of a workload, do not assume that you should just be able to kind of be okay
yes,
with this or be able to kind of manage that. That's an indication of your humanity, the fact that you
yes,
can feel. So definitely lean into that and get support, whether it's through speaking to somebody else in the team or just accessing psychological support or whatever it might be, and also offering support schools to maybe the friends who have highlighted it, because they've
yes,
also been witness to that story. So that almost
absolutely.
a little bit like that vicarious kind of way of kind of people seeing somebody else going through difficulty and feeling that same kind of challenge, just kind of checking in with them.
Yeah.
Let's not take for granted that they can also be impacted. Um,
Absolutely. I think
I
it's that community, isn't it? A community is touched by this.
coordinated approach,
And
yeah.
yeah, and it's everybody knowing that you can't pour from an empty cup and that everybody needs some support around what is happening. Because as you say that, humanity, we all have these feelings and we need to look after ourselves. It's the oxygen mask analogy as well, isn't it? Put your own oxygen mask on first
Absolutely.
and then you can give and help more. Um, and I suppose in terms of where to seek support as well is, as you said earlier, all the charities out there are amazing sources of support and help. The Mix is a very good one as well for people to reach out to in young
Mm-hmm.
minds as well for those
Mm-hmm.
teenage years. Um, and then I think as well, when we're thinking about all of these coping tools and strategies, the younger you start with talking to young people, to children about their thoughts and their feelings, the more proactive and preventative approach that you can take.
Yeah.
And certainly through the iSpace Wellbeing curriculum that we've designed and through the tools and the language, it starts at the age of 4 and it grows with the child,
Mm-hmm.
filling every week, giving them tools so that they have these strategies to support them when life gets hard and when those ups and downs come, and when certainly the pandemic, adversity, challenge, change. If you have the backpack full already with all of these tools, you're more likely to pull them out because you've been exercising that muscle all the way through your school life. So
Absolutely.
certainly we would like anyone listening out there to have a look at our iSpace Wellbeing website, recommend it to your teachers. It is there, it is free, and we want to be there to support and help. So, Nancy,
I
your
just
last
wanted
little
to,
word of wisdom for us all
yeah,
tonight.
I just wanted to really highlight again that knowing that some people might feel really, so young people might feel really uncomfortable talking, and that there are self-help books.
Yeah,
There's like Stopping the Pain. It's a workbook that you kind of go through. There's one around kind of doing it through a mindfulness type approach. I would always try and
lovely.
encourage you to connect with somebody, so that you're not having to kind of process it all by yourself. But even if in the first instance, if it is really challenging, kind of those self-guided books. But yeah, I guess in the sense that, we all in some ways might engage in some sort of self-injurious, self-harming behavior, in the sense of when we have a difficult emotion, whether it's a glass of wine at night because we're trying to get rid of the intensity of the emotion, etc. So we kind of, it's all on a range. So starting to destigmatize that
Yes,
and just think about, well, what's the emotion driving that? Okay, I had a really difficult day. So that's the equivalent of when maybe young people, because they don't necessarily have that full range of outlets that
yes,
we have as adults. And just to look out for each other, a coordinated, compassionate, caring approach, you know, notice when you see some changes in how someone's behaving and just check in.
yeah.
Knowing that you're there allows you to become more accessible for someone to just say, do you know what, that person does care about me, let me just, what if I just told them how I feel, or yeah, something.
Absolutely, absolutely. Talk, and if you're the person being talked to, listen.
Yeah.
Brilliant. Thank you so, so much. If anyone has any questions, please send them in to us. And I am so thrilled to have had you here this evening. Nancy,
Mhm.
thank you so much for all of your knowledge that you've shared with us this evening. It's very, very much appreciated. And I hope that we've been able to share that knowledge and understanding with people out there so that we can support our young people more because they need us right now. They've been through a lot, and we need to recognize and validate those feelings and that experience that they've been through. So
Mm.
thank you so, so much.
Lovely
And
seeing
I'll
you.
see you again really soon. So
Yeah.
for everybody, we've got lots more talks coming up through the month of May. Please come along and join us. Have a look at our schedule, and do keep sending us questions, and we will help in whatever way we can. Thank you, Nancy. Take care. Have a lovely evening, and I'll see you soon. Thank you. Bye,
Bye.
everyone. Bye. Bye.